haywire and could literally explode inside of me and kill me.
Appendicitis, food poisoning, and hospital procedures gone wrong. You guys have been asking for it, so today we are reacting to the widely popular YouTube comic ice cream sandwich. Let's dive right in.
I've come close to meeting my demise a couple of times, but somehow death can't really get a firm grasp on me, and I am still here. I ain't going out without a fight, baby.
I see people get hit in the head all the time. The biggest things we always worry about is if there's any laceration, fracture, or internal bleeding inside of the skull. When we're concerned about that, we'll end up getting a CT scan of your head just to make sure there's actually no bleeding in there.
Starting to feel a little gurgly. My bowels were making a movement, and I figured I probably ate something bad and went to the bathroom to relieve myself.
Ah, super common. So people will come in, gurgly, my stomach's moving, there's gas moving around, there's poop moving around. Go to the bathroom.
I have to go to the bathroom.
Most of the time people will have some relief thereafter. And you should actually look at your poop. Make sure that there's no blood in the toilet. Make sure it's a normal color. Certain things will help.
After going to the bathroom, I felt much better. Ooh, free food. And I went back to the original plan, having delicious and free. Oh, it's back. I was feeling really nasty again, and it was stronger this time.
He's eating food. It's probably not causing the food poisoning potentially. Anywhere from a couple hours to a day, food poisoning will kick in. So it doesn't typically happen right away.
As the seminar went on, I started to get more and more sick.
Yep.
And looked more and more pale. I would draw that here, but you know.
In these situations, hold off drinking a lot of fluids unless you can tolerate it, because that can then make you vomit and become more dehydrated. Get home, chillax, lay down. When you get that signal to go to the bathroom, go to the bathroom. We don't want anybody pooping their pants.
Halfway through the walk home, I was starting to feel really nauseous again, though. Then I saw a truck driving my way, and I thought it would be really embarrassing to be seen throwing up on the side of the road at like 8 in the morning. So I just willed myself to not throw up.
I see the opposite. I see people that come in who have these cyclic vomiting type syndromes. We see them sticking their fingers down their throat in the emergency department. Don't do that. We have medications to help.
I don't know how. Later, my roommate was talking to his then girlfriend, and she was like, that sounds a lot like appendicitis. You should take him to the hospital.
Appendicitis is inflammation and infection of your appendix. And if you do have appendicitis, typically we do a surgery here in the United States to remove it. If you're having abdominal pain, nausea, vomiting, fevers, there could be a virus, but you need to get checked out. If you're having a significant amount of abdominal pain that's localized to an area.
At the hospital, I'm asked a bunch of questions. Where does it hurt? How long has it been hurting? When did this start? Etc., etc.
We ask lots of questions on a scale of 1 to 10, 10 being the worst, what is your pain? And then doing a physical exam will then allow us to do the labs, any imaging that we need, kind of go from there.
And then the doctor told me, I think you have appendicitis. We're gonna have to move you to urgent care. What's appendicitis? It's the infection and inflammation of the appendix.
The reason why you're having pain from the appendicitis is the inflammation. The appendix gets infected, your appendix starts swelling, and the swelling and the inflammation goes to the surrounding tissues. Every time your intestines move, it goes over that area, it causes pain.
Failing to treat it can result in rupturing and infecting your entire body, which is usually fatal.
Yes, not usually fatal, but increase the risk of fatality.
Fatality.
Basically, if your appendix breaks, it bursts open and then poop is leaking into your abdomen.
What's an appendix? It's a useless thin tube in your lower right abdomen. It serves no function of the human body.
Yes, it is a useless little dinky thing that looks like the size of your own pinky, just sitting there in the right lower quadrant. It's not really used for anything. It's like kind of a remnant anatomy from evolution, basically.
Yeah, so I was going through mountains of pain and suffering because this little tiny part of me that has no purpose was going haywire and could literally explode inside of me and kill me.
I get so many patients that come in that say, I'm gonna explode, I don't want to explode. Usually they get the appendix out before it explodes. Actually, sometimes people feel relief after it perforates, which is the word that we use instead of exploding.
I was bitter, but I had no other choice. They admitted me to the hospital for emergency surgery.
Emergency surgery could be emergency that second, or it could be emergency the next morning. We'll put you on antibiotics, we'll keep you NPO, which is nothing by mouth, give you IV fluids so you stay hydrated, and obviously treat you with anti-nausea medicine and pain medication.
This was not the plan. In the hospital, they take me to the scanner room.
It looks a little too deep to be a CT scan. It looks more like an MRI. You only use an MRI actually for pregnant individuals because there's no radiation exposure. Majority of the time we use a CT scan.
They needed to look inside of my sweet bod to assess the situation and to see how dire it was. I didn't know how they figured this one out, but I guess that I was too thin and that made the scanning more complex.
So if you're actually really, really skinny, all the organs are sitting right next to each other with minimal fat in between. And so it's really hard to distinguish the different organs that are sitting right there. Somebody who's super skinny, you probably want to use IV and oral contrast to light up the different organs that are in the abdomen.
After the scanning room, I was back in the hospital bed waiting for the next steps when I got a visit from the anesthesiologist.
The anesthesiologist is the doctor that takes care of your sedation and your breathing when you're under. They'll keep you sedated, typically with anesthetic gases. They're there to monitor you and make sure that you're fine and safe.
He and the surgeon were talking, and I heard them say they needed to pump my stomach for safety. John then turns to me and says, with some kind of twisted joy, "Oh, you're not gonna like this."
These orders are all kind of weird. Normally what happens, you come to the emergency department, you check in, you're evaluated by your nurse and you're evaluated by the physician. You say, oh, okay, this is the differential diagnosis. This is what it could be. You do blood work and imaging. Get your diagnosis if you have one. Then you'll be whisked off either to the operating room or to your inpatient bed.
To pump the stomach, you have to have a tube pushed down your throat. It's a long piece of plastic that you have to continuously swallow down until it reaches your stomach. And then they can turn it on and get all of the stuff out of your stomach. I don't think you need any convincing when I say that is terrible.
The procedure does suck. And most of the time, the patients who have it in feel significantly better once we're able to suck out whatever contents in the stomach there are that need to be decompressed.
Also, you can do it wrong. If you don't position your head correctly, it can hit the back of your throat and make yourself vomit. And guess what I did? I threw up everywhere. On myself, on the nurses, on the surgeon who was trying to help me with the tube. What if I don't make it through this? Will I ever see you again?
So if you go through the nose, it actually decreases the gag reflex. One of the major reasons why we actually go through the nose if you're awake.
Finally, I was rolled off to surgery and moved to the operating table. Oops, one more touch to the back of the throat for good measure.
Don't understand exactly why he needs this during his appendix surgery unless he's super dilated and it's causing an obstruction.
And then I woke up. Appendixless. I was cured.
So what ends up happening is you wake up from surgery and you're like, holy cow, it's already done.
Where am I?
You're given medications basically that do cause amnesia, sedate you, and you lose track of time.
I spent the next day healing a little bit. My mom visited. I watched cartoons on TV all day, and I got soup and an icy pop and juice for meals, which seemed like a lot of sugar for a hospital to give someone, but hey, this is America, baby. Sugar is like our aspirin, and I didn't mind. I just went through a lot.
Yes, you need to be able to eat after surgery. Usually we give sugar-free Jell-O. Typically you need to be able to poop and pee after surgery. Get up, walk around, make sure you're okay. This was actually pretty good. The animation was really funny, and actually the storytelling was right on point. And it's actually pretty accurate for what we see in the hospital. Obviously, there's some variety depending on where he is in the world and the standard of practice where that hospital is. But in general, it's pretty darn on point. If you guys like this, definitely check out this playlist right here. And as always, make sure you subscribe, turn those bell notifications on, and hit that like button. Thank you so much for watching, and stay healthy, my friends.